have a talk for us about the introduction and the clinical application about the Exofin. It's an innovative skin closure technology. So I will introduce you very short. So Dr. Panu now is the Chief Medical Officer from the Siemens Medical Company. And Dr. Panu is an orthopedic surgeon and specialized in high tension wound closure and complex wound management in the spinal deformity reconstruction, and also published outcomes on surgical adhesive infection prevention and adjuvant therapy for challenging wounds. So we are now have you to have a talk with us. Thank you.
Hi everyone, my name is Dr. Chaitanya Panu. I'm an orthopedic surgeon and I'm routinely applying Exofin Fusion. It's my pleasure to be with you all today and give a talk on topical adhesives and Exofin Fusion itself. And it has a tension strength of almost 4 O suture, and it's almost waterproof and completely antibacterial and antimicrobial barrier properties, and has high flexibility when it's applied. From the market competitors, it provides you fast setting time, and it has a market differentiator antimicrobial property of almost 14 days. Now 14 days is for our just the tube when we apply, and almost 21 days when we apply it with the polyester mesh, which we are going to show you in a while. So this is Exofin Fusion, which I was talking about, and this has a polyester mesh over which we apply 2-octyl cyanoacrylate. And then this 2-octyl cyanoacrylate makes a bond, which provides a higher strength. It has curved edges, which you can see here, which decreases the stress area to almost 67%, which is not available in any other provider at present. And this has ideal setting time because almost 60 seconds it sets out completely, and we don't need to apply any other dressing even afterwards. And we have 2 tubes with 1 package, which provides kind of flexibility that if 1 tube is not working enough, or if you have a larger incision, it can provide you almost 1.75 mils of adhesive, which is a great flexible option. Now these are some photos which I just wanted to show how it's being applied just with the tube itself. Whereas I wanted to stress that it has a great application in cosmetic plastic surgery, especially in facial, breast, and other plastic reconstructive procedures, because it provides a great adhesion as well as approximation for the epithelial layers, which decreases scarring and provides a great aesthetic outcome to the scar, as well as patient satisfaction, which is proven in many studies. It also eliminates any need for suture removal and enhances patient comfort as well. Now these are some studies which are specifically for cosmetic and plastic surgeries, and I just wanted to tell like this study at the upper part of the slide, which is in the skin graft stabilization, and this is the lower one is for skin cancers and for epidural closures. If you see this study in 2023, this is for facial and neck wounds, and the lower one is for breast incisions. So it's already proven, widely used over the world, and it's provides great outcomes in patients with plastic and cosmetic surgery. Now there are some photos and videos which we felt are appropriate to be shown here. The first photo shows how it's applied, and the second video shows how in breast augmentation it's being used. That's it. So this is also again a photo showing how it's being used in breast augmentation procedure. This is again in modified radical mastectomy, long incision, high strength and stress area, but it's holding it nicely. You see, this is again a mastectomy, a view from far end of the theater. It shows how the long incision is and how it's beautifully applied on the incision. Again, a mastectomy incision, both sides, doing it nicely. Now some photos just to show how it provides a great cosmetic outcome. If you see, and in small lacerations, we can just close it without using any kind of sutures. Here, there has been no suture which has been applied on the deeper layers of the skin. But if you see the wound here, after 3 months, it doesn't show even that there was some kind of laceration. Similarly, in the scalp as well, this is a large incision. No sutures have been applied, but if you see after 2 months, hardly any scar visible there. So it's a great option as well if you apply it in high tension doses. Now we use it in hip replacements and knee replacements in terms of orthopedic surgeons, but it is a great kind of option in abdominoplasties and mastopexies as well, which are under great mechanical strength. Because what happens is sometimes sutures we can't distribute them evenly. There is higher density of sutures at one place, and sometimes we are not able to provide that many sutures at other places in the skin incision. Whereas with this kind of option, it evenly distributes the stress without we have to, worry consciously where we have applied sutures, how much density is there, or if their density is less. I just wanted to show how is the progression in knee replacement patient, where there is constant movement after the operation. If you see, you have to do a lot of physiotherapy immediately after knee incision, and it's beautifully holding the bone, and there are great outcomes after 14 days. This is again how it's being applied in breast augmentation surgery. This is for Exofin Fusion. The previous one was the glue, how it's being applied. If you see, first we apply mesh, then we apply the glue, and then later on, this is how it's being done fully. If you see the video, there you go. So it's very quick, it sets very quick, and now it has set fully. You can't feel anything. And the amazing aspect is you don't need to apply any kind of dressing on the top of it, but for the sake of satisfaction from the surgeon's point of view, usually many surgeons apply it, and it's kind of waterproof. Patient can have a shower as well on it. Of course, the usual recommendation is not to wet it, but still, if it gets wet, it's kind of waterproof and doesn't allow moisture to get into the incision line. Yeah, so this is again another application in abdominoplasty, again for Exofin Fusion itself. The first step is to apply the mesh here. And you apply the glue, and then is the video. Yeah, it dries very quickly. It's almost, we say it's 60 seconds, but usually in 40 to 50 seconds it's completely dry. And it's very quick. This is again a video for removal of the ester mesh after 2 weeks, which is usually recommended time. And this is how it looks after it's being removed. Sometimes it sloughs off by itself as well, if the movement is happening a lot on the area. These are again some pictures to show how Exofin Fusion is being applied in high stress areas like neck, and you can see after removal of the polyester mesh and before removal. This is again one of the big incisions after liver transplantation, which is holding up nicely. And if you see like on post of day 22, nice outcome afterwards. There are some studies which shows that complications such as fluid exudation, which can happen at certain specific places, such as skin grafts, at genital urinary tissue defects due to fournier gangrene. This kind of application of these glue which are containing two-ptyl cyanoacrylate is basically helpful in those situations as well because it minimizes it. Now, there are both sides. Sometimes if there is an infection, then we have to be careful as well because it depends on the practice, but usually it's beneficial most of the time as compared to it causes infection itself. Now, if you see, there are studies, a lot of studies, which says that with the help of application of these Exofin Fusion and Exofin, the wound closure is faster compared to traditional methods. It has lower risks and superior healing, and it also extremely enhances workflow and outpatient and ambulatory settings. There are some studies just to prove that. This is the latest review done in Southampton in UK, which says specifically that the infection rates after 7 days post-op were significantly lower with cyanoacrylate as compared to the subcuticular sutures, and the adhesives which are available in the market differ in the form of application, viscosity, as well as strength. Now, in all these three attributes, Exofin Fusion is kind of market leader, and it has the highest viscosity. It provides great strength as well as flexibility, and it has many, almost 3 to 4 application tips as well, through which you can modify your application for smaller incisions, for larger incisions, for broad application or narrow application over the suture lines. And it prevents and decreases cost on skin sutures as well as teres tips. Plus, it's faster, that's why it saves time and money for expensive anesthesia and surgical time as well. These are another studies which are showing the same conclusions. This is specifically for wound closure in skin cancer patients, providing great cosmetic outcomes after the application of cyanoacrylate sutures. Again, these are some studies that to prove that this prevents surgical site infection as well. If you see, this is the top studies in the spinal surgeries, and they have conclusively said that it has lower rate of surgical site infection than closer to the staples. And the low one is for cleft lip repair as well. They have said as well that it provides and decreases the incidence of surgical site infections. Now, these are our studies which we have published ourselves from Exofin and Exofin products. If you see, this has been tested in vivo performance under tension for a knee replacement and hip replacement, which we have published. There are studies which provide conclusive evidence that it provides great microbial barrier and infection resistance. These are studies which we have and for our products, and it has been compared with other products which are in market also. So the top studies for the joint replacements which we have got, and it compares us with other providers. The lower study is published as well. This is myself as the first doctor, just to because there are very small chances of allergic contact dermatitis with the glue. If somebody has been sensitized earlier, and we did a review, basically to know the incidence, and incidence is very rare, around 1 to 2% as the outcome of this study. Now, these are the studies to signify the microbial barrier effects of Exofin Fusion in the STOP study, which was published in Surgical Infection recently in May 2025. We have conclusively proved that the extent of microbial barrier provided by Exofin Fusion surgical incision closure system is almost 21 days. And in the lower study that is also published in Surgical Infection in 2024, October, says that it provides over 14 days of microbial barrier to the wounds. This is for Exofin HBTSA, which is without the application of polyester mesh. This is just a bit of competitor analysis for the polyester mesh as well. For the rounded edges, which we talked earlier, the rounded edges basically decreases the skin breakdown incidence, decreases the amount of skin tension on the edges of the wound itself, and that's why it is kind of gentle and safer for the tissues, decreases blister formation because there is less movement of the top layer, epithelial layer of the skin, and hence it improves patient outcomes. This is a technical study. So in conclusion, I can say that topical skin adhesives provide great and superior clinical and cosmetic benefits. That's been proven in many studies. It improves outcomes, patient comfort, and practice efficiency also because it's faster for application. Exofin is market leader in this space, and this provides best closing option for any kind of surgical incision. And Exofin Fusion provides strong evidence in all kind of plastic surgery procedures. Thanks very much for listening, and I'm happy to take any further questions if you have. Thank you.
Thanks, Dr. Panuru. So, any questions from the audience? Dr. Panuru, thanks for your talk. I have two questions for you. You mentioned about the skin graft. So
Yeah.
can you talk detail about the application of the Exofin or Exofin Fusion to the skin graft? And another question is about the platelet surgery. So is the Exofin proper to apply the Exofin on the mucosa area? Thank you.
I think these are great questions which I am asked quite routinely. I would say first, in response to first question, it's widely used in terms of skin grafts because in skin grafts, when you're applying it, and I have done skin grafts myself as well, when you're applying it, you have to approximate it very closely, and then you have to apply a suture as well, which is very cumbersome technically sometimes if you don't have an associate. With this glue application, one person can just or surgeon can keep the edges approximated, whereas any help or nurse can apply the glue and it holds it in its place, and it's a very secure kind of approximation, which is very nice for the surgical outcomes in terms of skin grafts. And in difficult areas as well, let's say if you are doing the skin graft in difficult areas such as groins or axilla or these kind of weird locations, these also provides great opportunity because it's very quick and faster to apply, and it also provides good microbial barrier in these situations and doesn't allow microbes which are generally present in these areas to grow in such kind of surgical incisions. So yeah, I would definitely say that it's a very good option for skin grafts. Now, in terms of cleft lip repair and submucosal incisions, it's been commonly used. Cyanoacrylate glues are commonly used. Even Exofin is being commonly used, but it's not approved for that kind of indication yet. Now it's being used for gynecological procedures in vagina, in rectal areas as well, and it's being used in oral areas, even inside the grafts for oral mucosa as well, to answer your question. But it's an off-label indication for any cyanoacrylate glue on the market. It's not being approved by FDA, but surgeons do use it routinely for this application. Thanks.
Okay, thank you very much. So any
Thank
questions? So any questions? So thanks, Dr. Panu. Due to limited time, we have to close this section. Thank you very much.
Thank you. Thank you.